Hi, it's great to be back with you. Last time when we did one of these video chats, we just got a ton of questions that came in, so many that I couldn't answer them all in that one session. So we will continue to create these video chats over time and continue to answer questions that have come in the past and new ones that keep coming in. So I appreciate you sending in your queries. We will try to answer as many of them as we possibly can. Okay, so on to today's questions. Let's see. Charles writes, I don't want to eat vegan or vegetarian, but I want to improve the rest of my diet in addition to using step 1 foods. How can I do that? So if you look at the data, it's very clear that a whole food plant-based diet is the healthiest, meaning whether you look at heart disease, cancer, diabetes, dementia, eating a plant-based diet is the most protective. Plant-based doesn't necessarily mean plant only. It's just that plants become the majority of what you eat. The Tsimane tribe, which is that tribe in Bolivia that has the cleanest heart arteries documented, they are hunter-gatherers, so they actually do eat some meat. Now, 25% of their calories comes from meat and 75% comes from plants. But if you think about that from a volumetric perspective, meat and animal-based products actually end up being quite small minority of what these individuals consume. 100 calories of beef is about this big. 100 calories of lettuce is about this big. So what ends up on your plate actually is, from a proportion perspective, far more over on the vegetarian end of the spectrum. I'm not a vegan. I don't demand that my patients are vegans, but I do try to eat more plants whenever I have the chance. Because food is so cumulative in terms of, us consuming something 3-4 times a day, every single day, 365 days a year for our entire lives, even small changes can have a big effect. So one of the things that I often instruct patients to do as they're getting more into this plant-based eating approach is make a small change. So instead of having meat with vegetables, have vegetables with meat. It's subtle, but there's a proportion change that's happening on your plate. And over time, that has big effects. So I think what I would say is whenever you have the opportunity, try and favor plants. You don't have to be perfect at this. Everyone can be better. This isn't a matter of perfection versus a waste of time. It is, again, just moving on the spectrum towards a more plant-based eating system or approach, and you will be rewarded on multiple levels. Okay, next. Should I quit taking probiotics when I start using step 1 foods? Okay, that's actually a really great question. So for our digestive system, our digestive system is actually full of bacteria. It's called the microbiome, and we're just learning about this ecosystem, how complex it is, what effects food has on it, and what effects the microbiome has on us and on our health. To maintain the healthiest possible microbiome, you kind of need 2 things. One is prebiotics, or sort of the infrastructure on which the bacteria can grow, and then probiotics, which is like the food that we give it to allow the bacteria to multiply in the right direction, so that we're favoring beneficial bacteria and not enhancing the growth of counterproductive bacteria. Okay, so prebiotics are actually step 1 foods because prebiotics are whole food fiber, antioxidants, right? Some healthy fats. So it's really and especially the whole food fibers is a main prebiotic. So eating a fiber-rich diet gives your microbiome kind of the infrastructure on which to thrive. Probiotics come from fermented foods especially, so fermented dairy like yogurt, kefir, sauerkraut, kimchi, pickled beets, right? So pickled and fermented foods are sources of probiotics. So it's actually, the two are complementary. In some sense, sprinkle with yogurt is actually one of the best things you can eat for your microbiome. So absolutely, you do not need to stop your probiotics. In fact, the probiotics with our foods are synergistic in terms of helping maintain a healthy gut biome. Okay, next. Are you adding new products? Yes. So we know that 6 products are at some point limiting, because you might get bored eating the same things over and over. So we are very much looking forward to expanding the line. In the very near future, we will have our peanut butter bar back, which we're very excited about. We're actually now able to make it in scale, and so just as soon as all the packaging and everything is coordinated, we will have that as something that's available to you. We're also working on other bar flavors and hope to add some savory items like crackers in the future. So keep your eye out for that, and we will be making announcements as new products come out. Okay, can you speak more about heart disease risk? How does diet impact your risk? So heart disease is a multifactorial disease, meaning there's many different things that come into whether or not someone ends up developing heart disease. And there are some things we can't change, right? Heart disease risk goes up as we age. And if we have a family history of heart disease, we can't change our birthday, we can't change our family. So those are intrinsic risks that we have. The rest are modifiable. There's a couple that we have sort of a lot of control over from the way we act. So it's physical activity, so being inactive increases your risk, and smoking obviously increases your risk. So quitting smoking and becoming more active are really important to help reduce cardiovascular disease risk. Now, there's 5 other risk factors, and that's high cholesterol, high blood pressure, high blood sugar or diabetes, excess weight, and poor diet. And if you think about that, those 5 risk factors are all food related. So the vast majority of cardiovascular risk is related to diet. It's the foods we put into our body, which is why it's so important. It's so important to pay attention to what you put in, right? I mean, I return to this analogy often when I talk to my patients, and that is, we fuel our cars better than we fuel our bodies. Right? If you drive up to a gas station and you open up the gas tank and you look on the side and it says, on the inside, the instruction says, premium unleaded only, right? Would you ever think about putting in diesel? Of course you wouldn't. You know that would wreck the engine, right? And yet we put in diesel into a machine that requires premium unleaded, or however you want to, use the analogy, but we put in the wrong fuel and then we expect it to run perfectly. It won't. We have to try and put in the right fuel. The great thing is our bodies are incredibly resilient, and they can actually, reward you with improved health, with resilience, as you improve your diet. So that's why diet is really, really important, and that's why step 1 is so focused on nutrition, and those are the risk factors. So very much food related, and then obviously if you're smoking, please quit. If you're inactive, start moving. Even walking around your couch a couple of times is better than sitting on it all day. It's every little bit helps. Okay. What do you do? Oh, this is related. What do you do if heart disease is hereditary? So, family history is absolutely a risk factor for heart disease. So, if everyone in your family develops heart disease, you're obviously at higher risk of experiencing the same, health issues. However, genetics is not destiny. Genetics is predisposition. And I think of genetics very much like the story of the three little pigs, right? Genetics are a blueprint. They're a blueprint instruction. Well, each one of the little pigs got a blueprint instruction that said build a house. But the three little pigs used different materials to build their structures with very different results, right? So always build with bricks, not with straw. So even if the plans you've been handed are faulty, you can overcome that genetic predisposition by how you live. If you have a very strong family history of heart disease, it becomes really important to look after your risk factors. Know what your blood pressure is, know what your cholesterol is, your blood sugar, your weight. Make sure you're not smoking, right? Be physically active, like going back to all those modifiable risk factors that we have. Make sure that they are all optimized, right? And if you do that, the chance that your genetic predisposition manifests into an actual outcome is markedly reduced. Markedly reduced. Genetics probably accounts for about 20% of the risk, which means 80% you have control over. Okay, next. If I get my cholesterol numbers down to what I want them to be, should I continue to use the products as regularly as 2 per day? So, like medications, right? If you're using statins to lower your cholesterol, you're going to see the effect from those statins so long as you are taking them, right? So if you stop taking the statin, your cholesterol will go back up to where it was before you started the medications. This is why step 1 is just meant to be step 1. So you can move beyond step 1 foods, right? And really embrace this whole food, plant-based eating approach where you truly are eating beans and greens and nuts and seeds and fruits and vegetables and grains in their most whole and unprocessed form. And over time, because your overall eating plan has shifted to basically what step 1 foods provides in a couple of servings, you can certainly reduce your use of step 1 foods because you're achieving the same nutritional endpoints in a different way. But if you achieve a certain cholesterol profile on step 1 foods and then stop them and go back to what you were eating before, chances are very high that your cholesterol will go back up again. So this is meant to be used as a intervention on your cholesterol. It's meant to be a starting point for you to make additional changes so that your need for step 1 over time reduces. Not that you can't keep eating them. They're wonderful foods and many people find them convenient and delicious and so use them for that purpose alone. But my hope is that as you embark on this, you think of this as a broader mission for your own health, that you continue to add more plant-based foods, more premium unleaded into that, put more premium unleaded into that gas tank. Okay, next. How does step 1 foods help with blood pressure? Are the step 1 products safe to use while currently taking certain blood pressure medications and blood thinners? Okay, so let's talk about how step 1 foods can help with blood pressure first, and then we'll go on to uses of the products in conjunction with other medications. So first of all, one of the main ways that step 1 foods helps with blood pressure is by reducing your sodium intake. Sodium is incredibly prevalent in our food supply. If you purchase anything that's pre-made or pre-prepared for you, chances are very high that it's going to be loaded with salt. Anyone with, actually, let me step back. In general, in the ideal world, everyone would be consuming under 2,300 milligrams of sodium per day. That's just 1 teaspoon of salt for the entire day. Okay? Most of us consume a multiple of that. So 2, 3, sometimes even 4 times that amount on a daily basis. If you have high blood pressure, reducing your sodium further down to 1,500 milligrams per day is recommended. And to put things in perspective, in communities of individuals where hypertension is essentially unknown, average sodium intake is about 500 milligrams per day. So in some sense, every grain of salt we add to our foods is salt we don't need. Okay, so one of the ways that Step 1 Foods helps is because we're replacing with very low to no sodium foods, with the exception of the pancakes. The pancakes do have baking soda, baking powder in them, so you're going to have some sodium there. Otherwise, they wouldn't rise. They wouldn't work as a pancake. But anyway, going back, everything else has basically no sodium in it. So we're substituting in foods that are low, are sodium free, for ones that probably had sodium in them. So we're helping reduce the amount of sodium that you're taking in. The other part that's important is that there's more obviously to food than sodium content. And studies have shown that when you increase whole plant-based foods into the diet, in addition to lowering sodium intake, you can actually attain blood pressure lowering effects similar to that of a medication. So increasing the intake of whole food fiber, antioxidants, omega-3 fatty acids from real whole plant-based foods, in addition to reducing sodium, so this is what Step 1 offers, you can help reduce blood pressure sometimes to the extent that you need one less medication to control your readings. Okay. Then are the Step 1 products safe to use while currently taking certain blood pressure medications? Yes, there is no expected interaction between our foods and blood pressure lowering medications or cholesterol lowering medications or blood thinners for that matter. So we should not be interfering with any medications that you're taking. But, everyone has their specific health issues and conditions. So if you're in doubt about your particular situation, please check with your healthcare provider to be absolutely sure. But these foods truly were created to be safe and effective and, very clean, meaning, no additives, no preservatives, no colors, no flavors, real whole food. What can I add to my products? Can I make the oatmeal with milk? Is it okay to add butter and syrup to the pancakes? Okay, so these are meant to be real foods eaten in the real environment. And when we did our trial, we did not, ask people to markedly change what they ate. In fact, they received a box of our products with the instruction and control foods on a separate occasion. Pick whatever you like out of this box, eat it twice a day instead of something you're eating already. There were no restrictions on whether the oatmeal was eaten with milk or not, whether the pancakes were eaten with syrup or butter or not. It was just a real world experiment. So if you typically eat your pancakes with butter and syrup, okay, go ahead and do that. I would hope that the pancakes are flavorful enough and interesting enough that you'll need less of those less of those additions. And you can always think about healthier healthier hacks, right? So maybe slice up some banana on top, or use blend up some frozen raspberries and sort of drizzle them on. So you can do other things. You can warm those up, right? So it could be like a raspberry syrup, and try that on the pancakes. Again, it's not so much that that maple syrup and a little pat of butter are the end of the world. No, but again, every small little shift towards a healthier eating pattern is going to pay off big down the road, because it's so cumulative. I know I'm a broken record about this, but it's so true. It's so important to keep in mind. So can you make the oatmeal with milk? Absolutely. If that allows you to enjoy it and makes it sustainable and pleasurable for you, great. And if you want to do what I do when I make my step 1 oatmeal, I throw on a handful of fresh blueberries on top, or other fruit I have around. I mean, you don't have to be completely limited by each of these servings. But again, if you're going to add things to them, try and make them as healthful as possible within the context of you still enjoying what it is that you're eating. This is meant to be a pleasurable experience. This is not meant to be something that you don't look forward to. Here's a question that we get asked often, and that is, should I stop taking my statins when I start using step 1 foods? And my answer to you is no. Please don't stop any medication or change the dose without first talking with your healthcare provider. You were placed on that medication for a reason. And so you want to be sure that you are not jeopardizing anything by changing the dose or by stopping the drug. Never, ever do that on your own. My goal for my patients is always to, the less is better. Not because I think drugs are bad or evil, but because if we can solve things with the way we live, it's a much, much better approach than camouflaging, what we're doing with a bunch of drugs, right? So the fewer drugs, the better. But please don't embark on, self-reducing medications, because you were put on them for a reason. Now, in terms of, what can happen is that when you eat step 1 foods, you may find that cholesterol levels go down further than, they got to when you were taking the medications on their own. And under those circumstances, it may be very reasonable to discuss with your physician whether or not it would make sense to reduce the dose of statin that you're on, and then recheck. But you should do that, quite methodically, right? So if you're making a change, test the result, test the outcome of what it is that you did. So the other thing I should mention is that there are some people who should be on statins, if possible. I mean, they have to be able to tolerate them, right? But some people should be on statins regardless of what their cholesterol numbers are, because the data, and I really believe in following the data, right? Because the data shows that if you are on a statin and you're in this cohort of patients, that you will benefit from a risk perspective, right? And really, this needs to be emphasized. We put people on statins not to make their cholesterols perfect, right? But to reduce their risk of having a cardiovascular event over time. So it's about risk reduction. It's not about cholesterol reduction. Cholesterol reduction is a means to the end, not the end in and of itself, right? So people who have so going back to risk, people who have known coronary disease, so you've had a stent, you've had a heart attack, you've had bypass surgery, you flunked a stress test, right? So there's evidence of atherosclerosis in your body. You've had a coronary calcium scan, and your calcium score is far ahead of what we predict based upon your age and gender. Okay, we consider you to be higher risk, and those individuals, like I said, in studies have been shown to benefit from being on statins for risk reduction, even if they start out with normal cholesterol readings, right? So remember, this is not necessarily about cholesterol alone, it's about risk. And here's another really important thing to keep in mind. The reduction in risk from cholesterol lowering from drugs is not nearly as great if you're only doing it through drugs, as opposed to a comprehensive drug plus lifestyle approach. Okay, that lifestyle, changing lifestyle, improving diet especially, potentiates the risk reduction from statin medications. So it's really it's really the combined effort, especially in those individuals who are clearly in a group that benefits from being on statins. It's not just about getting your cholesterol number down to a certain level. That's important. But it's how you do it, right? And if it's drug alone, not as much risk reduction as if it's drug plus diet. Okay. And then let's see. What do the clinical trial results mean? Well, we are really proud of having performed this clinical trial. It's not been done before, believe it or not. I mean, we've been doing research on drugs, on procedures for decades, a century or more, right? But yet we've not done anything like this, where you take a pre-prepared, right, kind of pre-dosed, pre-measured food intervention and give it to people to try, and then measure the result in a free living experiment, right? Many food trials have been done, but they're all very controlled. They're done in laboratories where people, come in. Their food is very, very controlled. So there's certain servings, and when you're testing, one intervention, everything else is the same from time to time. So it's not a real world kind of setting. And we did a real world trial where, like I said earlier, we just gave people a box of food and said, hey, just choose any two things out of here, that you enjoyed every day for the next 30 days instead of something you're eating already. Like, that was it. Oh, and by the way, don't change anything else. You don't need to start exercising. We don't want you to all of a sudden start eating salads morning, noon, and night. I mean, it would be great, but we weren't testing that. We just wanted to see what would happen with the foods alone. And even with that, very minor change, uncontrolled, without anyone looking over the shoulders of our subjects to see whether or not they ate the food or not, we still achieved a very significant cholesterol reduction in the subjects using our foods, as compared to when they kind of redid the experiment and used the control foods. Not everybody had a response. So not everybody had a cholesterol lowering response, and that's to some extent expected. Not everybody responds the same way to a drug. There's probably about 30% of people with every medication that have a less than hoped for response, and sometimes even the opposite response. Like, sometimes we give patients medications for migraine headaches and they actually get worse, not better. So it's not always, things don't always work inside individual patients the way we predict based upon, experience, the average experience of people who have taken the drug before. So at any rate, so not everyone had a huge response, but 2/3 of people did. They had cholesterol lowering effects that were clinically really impactful, like 10+% reduction in LDL, which is a big deal. I mean, that's a same percent risk reduction. So, and some individuals had close to 40% LDL lowering, which is equivalent to high dose statin drugs. Not everyone. We don't pretend to promise the moon, but it only took 30 days to see what kind of response you can have to a food-based intervention for cholesterol lowering. And again, remember, the food part is really important no matter how you get your cholesterol down, whether it's food alone or whether it's food plus drug, because it's that foundation of dietary improvement that really boosts the risk reduction attained with cholesterol lowering. Okay, so that's our session for today. We will be continuing to answer your questions as they come in. We have more to cover, so there will be another session probably in 2-3 weeks, and we will continue to try and be a resource for you and provide you not just with delicious food, but also with information that is useful, practical, and that you can trust. Okay, thank you for joining me, and I look forward to speaking to you again. Take care.